I thank the Minister for that answer, but we know that there are GP appointment difficulties everywhere, but we also know that it's much more difficult in more deprived communities. Social Market Foundation research showed that GPs in more deprived communities had twice as many patients on their books than those in more affluent areas, and that means that in addition to the greater health inequalities in those communities, people in those communities are finding it very, very difficult, like at the Royal Primary Care practice in Staveley. So why is it that patients in more deprived communities should be expected to tolerate far greater difficulties getting a GP appointments than those in more affluent areas?
Okay, that's it. In Derby and Derbyshire, for example, there are 495 more doctors and other patient-facing staff than there were in 2019. So step one is to have more clinicians, which we are doing through that investment. He raises a point about Carr-Hill and the funding formula underlying general practice. Now, there is actually heavy weighting for deprivation, and the point that he raises is partly driven by the fact that older people tend to live in not the least deprived areas, younger people live in high IMD areas, and that's the reason for the statistic that he used. But of course, funding is rightly driven by health need, which is also heavily driven by age. This is an issue we are looking at, but I think the interpretation that he's putting on things, that there isn't a large weighting for deprivation, is not quite right.